Hello, my name is Dr. Heather Domian, and I am the Executive Director of the University of Houston STEM Center. I would like to thank you for participating as a volunteer lead judge for our program called UH STEM Zone Saturday. We will embark on having our first STEM Zone Saturday of 2021 this coming Saturday of January 23rd. So I'd like to give you just a brief overview of what are the roles and responsibilities as a volunteer lead in the mechanisms of our particular program. Well, first of all, we have the ability to work with students across the Houston districts. I'd like to be able to share with you our screen for agenda currently at this time, is that we have a format that will be utilized where we will have 3 sessions presented in roughly about 55 minutes each. Where do we need you? You may ask. We need you to help to participate and ask questions, specifically during the first and second sessions. As you notice, the first session is going to be presented by the College of Optometry, and the second will be that of the College of Medicine. These 2 distinct sessions will be led specifically by the doctors themselves, in which students will have interactive activities with STEM. So you could help maybe encourage the students. However, we will not be in breakout rooms during this time, as the presenters requested for a whole group session. Although our third session with Dr. Erica Johnson with the Richmond Animal Hospital would like to be able to break out the students in rooms and to have a little bit more of a unique conversation focused on case studies that she herself has encountered working with clients in medicine veterinarian capacity. So with that being said, I just wanted to give you the rundown. We're going to have a quick introduction. We will have 3 sessions of about 55 minutes apiece. And the third session is where will be most highly needed to help be able to carry on a conversation with students within a breakout room session. Then last but not least, we will have a closure of the STEM Zone Saturday event. Now, let's talk about these particular type of case studies. The first case study is actually looking at a cat, and the cat here is named Fluffy. Cat is having some difficulty being able to go to the bathroom. And so there are certain mechanisms that you will see that are very similar for each particular type of case study that you could use. I'm just going to run over a few of these particular PowerPoints so that at least you have a better understanding of what you need to do and how you need to have that conversation with the students within that breakout room session. So we see how we have Fluffy, and then we have a case that is particularly presented to the student. This is what happens. You know, think of it when you may ask students, well, do you have a cat? Do you have a pet? And what happens? Have you ever had to take it to the veterinarian? What happens when you take it to the veterinarian? What does the veterinarian do? Was there a solution, hopefully, of course? Did the vet prescribe any type of medication that the particular animal had to take? You know, these are very inviting questions for the students to help to open up and have that conversation with you. And then ultimately, every single PowerPoint will have a sequential steps of thought processes that Dr. Johnson goes through, you know, as to, do I need to provide an X-ray? Is there an ultrasound need? Do I need to get blood work? Do I need to have a urine test? And furthermore, examinations. Next, you might also see the commonality among the different types of PowerPoints is that of gathering data from blood work and or also X-rays. This is something that veterinarians, of course, need to use, since unfortunately the animals cannot talk for themselves, so that we have to try to infer what is going on in that organism's body. And so ask the students, have them explore, what does this particular type of X-ray show? What can you see in this X-ray? Particularly in this X-ray, you might see that, well, here, this does not look quite normal. Maybe that there are some stones, but don't quite give them the answer just yet. Have them identify and observe that. Ultimately, then, have the students try to diagnose as if they themselves were veterinarians. What would they do in this circumstance? And then at the end, there may or may not be. And actually, here's what I did. Dr. Johnson is sharing her course of actions working with this particular type of organism. So that is one of the case studies. A second case study, of course, is then looking at Carson, a dog who's having some difficulty. And once again, I will just flip through these. You'll see that these are very common. Blood work, we have x-rays. Now, one thing about Carson is that Carson has two different types of x-rays given. One is a normal wrist of a dog, and the other is actually Carson's. And as if you noticed, what do you infer? That's right. Carson, unfortunately, has a broken wrist. And so then you could ask students, well, what would you do in this circumstance? Have you ever had a broken bone in your body? And what did the doctor do for you? Try to make it as much as relatable as possible. And then, of course, what are those course of actions that needs to take place? The third type of case is that of a turtle. And very similar, the case is presented. Then you have, well, what would you do? You have an x-ray to make those observations. Ask students if they even have had a turtle before. And what do they do? And then what's that prognosis for them? And ultimately, this is what Dr. Johnson did. But we really don't know quite the answer of what was the final result. And that's okay, because that's what will happen is after our fourth case study, which is the following, about Lucy, a beagle dog, having some difficulties. Once again, the case is presented, going through the process skills of figuring out what to do, presenting blood work, more examination was needed, looking at x-rays, both of a normal and that of Lucy's chest x-ray. Have the students compare, maybe toggle back and forth between these two types of images and to see what is different or what is the same. And then ultimately have the students try to diagnose. So that was a quick rundown over the 4 types of PowerPoints. Now, the question is, as a volunteer, do I need to show all 4 particular type of PowerPoints? No, we're not going to ask for you to do that because there will be limited time and we would like to have at least some type of in-depth conversation. So we're going to focus on where alternation of forms for each type of breakout room will have maybe 1 or 2 types of PowerPoints to have a conversation with, because when discussion is completed, we're all going to go back to the main room, and that's where Dr. Johnson is going to provide some conclusions and factual statements of, well, what happened? What did she do? What was the final diagnosis of that of case 1, 2, 3, and 4? So that's where we really need your help, and we are so appreciative of you being that volunteer lead during the 3rd session, of course, with Dr. Johnson. Afterwards, then we will come back as a whole group and have a conclusion. But overall, we want to thank you for participating. We know that this is a time invested upon your half of need. However, it's also a benefit for you to be able to garner some more information about STEM careers. So thank you once again. We hope to see you for the rest of this semester as we continue on after January 23rd. We will have 3 more sessions that will be actually February 27, March 27, and April 17. So mark those calendars. So we will see you very soon. And thank you so much, everyone. We look forward to seeing you. Have a great day.